This is a video tutorial for COTA 2210 on pediatric and adolescent handling and positioning in the hospital room. Please remember to refer to the assignment that I gave you in class that goes over sanitizing your hands, knocking on the door, introducing yourself. What we're going to do here, I will go through the introduction of sanitizing and introducing myself, and then we're going to come into the pediatric patient. On the pediatric patient, what we're planning on doing is lowering the bed rails, moving the sheets, educating the kiddo on what we're trying to do today, and then we're just going to have the child sit on the side of the bed, and then I'm going to return him. That is our plan for this first video tutorial. Here we go. Knock, knock, knock. I'm sanitizing my hands. Hi, Timmy. My name is Cassidy Hoff, and I'm from Occupational Therapy, and we are planning on running down to the therapy gym today. We're just going to sit on the side of the bed first to get you oriented to what's going on. May I look at your badge to see your name? Excellent. Thank you very much. All right, the next thing that I'm going to do after I introduce myself, sanitize my hands, I'm looking around the environment. I'm removing all of the hazards and making sure they're out of my way. I'm going to remove his fun animals. All right. And then what I'm going to do is on the side of the bed, there are different directions for raising the bed higher or lowering the bed. When we're transferring the kids, we want to make and adults, we want to make sure that the bed is lowered all the way. And you'll also notice now I'm lowering the back. When you come in, you will be able to see the blue panel that gives you those directions. We are laying him totally supine. Excellent. The next thing I'm going to do is lower the bed rail on this right side. On the right side of the bed rail, you will see a little black lever with an arrow. I lift up and I gently pull it down. The next part of the process is removing the bed sheets. I'm going to lift his arms up, and we are moving these sheets. So when we get you out of bed, we're not going to be stumbling all around them. Okay. Also, I noticed there is an incline on the foot of the bed, and I want you to see that observation skill. And now we'll lower the foot of the bed also. Overall, the goal is to make sure the bed's low and flat and the bed rail is down. Now what I'm going to do is I'm going to roll him to his side, making sure I'm watching for safety. I'm going to place one hand on his hip and one hand on his scapula and slowly roll him over, making sure that he is feeling safe. I'm then going to use my hand to come under his neck and place on the backside of his scapula. You want to make sure when we're transferring the kiddos or adults, we don't go underneath their arms because we don't want to affect or cause shoulder damage. So I have my hand on his pelvis and the hand on his back with scapula. I'm going to swoop his legs forwards and make sure he is stabilized. I am then going to make sure his legs are safe, and I'm going to stay in front of him so he doesn't fall off the bed or fall onto his back. Okay, this is as far as we're going to be going on this one. Now we're going to be laying him back down. What we're going to do is I want you to lay on your side, and you're going to scoop his legs up, making sure body mechanics. Okay, and I'm going to scoot him up a little higher so his head's on the pillow. Roll him supine, and then lay his legs back out. You also want to make sure the pad underneath him is not bunched up. We will then recover him. All right. And we always return how we found it. You can raise the bed rail up. I will raise the bed up. Excellent. and it will return the rail if it is up. The one thing also, sometimes we will have a call light, and we want to make sure that we leave the child in the bed as we found him, and his call light would be present. We'll have that on the next video tutorial. And return so he is safe and returned back to his bed.